frightening health issue, medical or health officials say the number of young people diagnosed with mental disorder is increasing in Papua New Guinea. Left unchecked, this will affect about 13% of the population. A survey indicates that most affected will be those in the teens to the late 30s.
More Papua New Guineans are getting better educated. An increase in its human resource population, the country stands a good chance of progressing well. However, like all other nations of the world, the youth population is at risk of being affected by some form of mental health disorder. Dr. Ludwig Nanawar, Director of Medical Services at the country's one and only referral psychiatric hospital, says this is an issue that must be taken seriously or could cost the level of productivity of the country.
This age group of people are supposed to be finishing the education, maybe like finishing tertiary education, university, colleges, and it's probably about time also that people should be getting job.
The World Mental Health Survey estimates that 13% of the country's adult population will experience some form of mental disorder in their lifetime. For the country, the types of mental disorders varies but are high amongst teens and those in the late 30s. One main cause is the excessive consumption of drug and alcohol, an issue which is prevalent amongst this age group. Being the one and only referral hospital in the country, Laloki Psychiatric Hospital does its best to treat the large number of patients that seek medical help. It has in recent years diversified its services to ensure patients are treated well. While the hospital has had a steady number of new admissions in the past 10 years, readmission cases have greatly increased. This, according to Dr. Nanawar, can be attributed to the inadequate resources and poor support that has been given to the hospital over the years. Laloki Psychiatric Hospital is a year away from celebrating its Golden Jubilee. In its 49 years of existence, the hospital has treated thousands of patients throughout the country. But the journey of the hospital has been filled with challenges, most of which exist to date.
We actually shut one of the wards down last year after a typhoid and a diarrheal illness outbreak in one of the wards, so it's shut. And maintenance work is going on, so that ward can house to potentially 20 patients. So our numbers have been cut down to about 60. Usually we have about 80, 100 patients at any one time.
The list of concerns faced by the hospital continues to grow each year. At the top of the list is the need to provide sufficient skilled staff and increase the number of wards for patients. A restructure in 2010 has seen the creation of new positions, increasing the staff ceiling to 160, 16 of which are still vacant due to the freeze in staff recruitment by the Department of Personnel Management. The hospital takes in an average of 2 new admissions per week, creating a strain on the limited and aging infrastructure. The World Health Organization estimates that half of all mental disorders begins after the age of 14. This statistic is evident for the country with the highest number of patients ranging from the teens to late 20s.
We mainly deal with severe mental health problems, like illnesses like schizophrenia and bipolar disorder and drug-induced psychosis, mainly marijuana, and also psychosis due to other medical problems like epilepsy.
In the past 5 years, the hospital has submitted average estimated budgets of 12 million kina, but only half of which get approved and funded. Adequate financial support is something Dr. Nanawa believes should be improved to complement the work done by the hospital. The fact still stands that Laloki is the one and only hospital that specializes in treating the sickness of the mind.
Bradley Gregory with that report. Another undesirable involving youths. They still cop a lot of blame for lawlessness in the country. But here is a counter from a youth coordinator from the Central Province. There are laws to champion youth advancement, but he says no resources to back it up. Again, Bradley Gregory.
There are other groups that are formed also in the city, but
George Mera is the chairman of the Central Province Youth. He has been working with the youths for many years. He says while government has tried to address youth issues in legislation, the problem still arises. He blames it on the lack of funding.
Looking back at the Youth Development Authority, the policy is already in place, but like any other government organizations, lack of funding is the whole idea here. We're going through a lot of constraints where we cannot even bring people, our youth leaders together, mobilize them, house them, run a meeting, and start identifying their needs and start running programs for them. So we can't do anything with funding.
In Port Moresby, there have been, however, active youth programs. Bus stop wardens and the Bitunath enforcers, all funded through the National Capital District Commission. These initiatives are good, however, are short-term programs and are not sustainable.
Thank you, lo governor, lo giving work come back, lo mibla youths, lo cleaning one map when mibla stop long and so mibla like one map when mibla stop and must look beautiful na, I must look attractive, lo I tourist one em.
Youths in both rural and urban areas have their own set of challenges. Over the years, youths have been engaging themselves in illegal activities. They have been the face of all the wrong reasons. Police in Port Moresby are concerned about this. NCD Metropolitan Superintendent Benjamin Turi believes the lack of job opportunities for the youths has led to the rise in crime.
People call it a silly season, but it's just that a lot of unemployed youth around the city. There's nothing much happening in the city for them to be employed, and that could be one of the reasons.
The schooling year is nearing its end. The reality is that not everyone will continue to stay in school. The country's teenage pregnancy rate still remains high amongst girls. Prostitution is also on the rise in many of the cities and towns in the country. Added to that is the involvement of women in robberies.
Are now being committed by females. Females are being used as well. So we can't just say all matters look committing crime now. Robberies and things like that. Females are being used as cover.
For the male though, drug and alcohol abuse continues to be high. Many non-government organizations have been engaging youths in their programs. On the positive note, the youths have been the driving force in many church activities. The Stations of the Cross in Port Moresby this year was led by the Archdiocese of Port Moresby Catholic Youth. Funding youth programs is inevitable. After all, the future of the country and any other of the world is in its youth.